Welcome to this edition of the First Aid Show. One thing you may come across is a patient who has taken an overdose. There's a lot to think about in situations like this, so we asked the paramedic how they deal with this.
It is fairly common, and not just in urban environments, for us to be called to people that have had an overdose of recreational or prescription drugs. Again, when we arrive on scene, we are looking for clues. Sometimes the person is conscious and is able to tell us what they have done. They often will have had second thoughts and realise that this wasn't a good decision, and they have called for help themselves, or they've told somebody and we've come to their rescue. If they are unable to talk for themselves, again, we look for clues to try and identify what it is they may have taken. So that might be asking their flatmates or people nearby, or we can see, we call it paraphernalia. So you might see spoons, syringes, papers, different things like that, little wrappers, and that all helps provide us with clues of what they may have taken. We can look on their arms and their limbs for injection sites, and the other thing we can do is we can open their eyes and have a look at the pupils, and that sometimes indicates whether they have, what type of drug they may have taken. Their pupils will either be really, really dilated, or they'll be really tiny, like a pinpoint. Another thing that we do in those situations is we look for empty packets, empty medication packets, and we retrieve absolutely everything that we find to take it to the hospital. One, because it's evidence and we can count up how many tablets are missing and calculate how much they have taken and what the likely side effects are. The second thing is, hopefully, there is nothing remaining in the house that if they had another bad day that they would be tempted to again make the same decision and take an overdose again. We sometimes go to patients that are recreational drug users or have become addicted to the drugs, and they are coming off it, but they're going through a managed process and they've been to a clinic to help them detox. In this situation, they will still be taking very strong prescription drugs in order to manage coming off and manage their addictions. So we often look for patches that they may be wearing, or they may have bottles of methadone or other things like that. And they're always, we find, very open about what they've taken and, you know, the strength of it and the process, the stage in the process that they're at in their recovery. If you go to people that are unable to speak for themselves and they look like they are intoxicated, and this sometimes happens even for elderly patients, we always check their skin for patches, because sometimes they have more than one patch on, which has had the effect of giving them an overdose based on the size of their body. So it's always worth looking, because a well-intentioned carer or family member may have applied another patch and someone else has done it, and then actually they've now had a morphine overdose that it was totally by accident. And we can look at their pupils and see that they're really tiny, and we can reverse that. We carry a drug called Narcan. Some drug users and some clinics provide Narcan to regular users so that we can reverse the effects of the opioid. So they are very simple to use, and if you find somebody that is a user of opiates and they are unconscious, their breathing has stopped or reduced, and they have very tiny pupils, then that may be a really helpful line of treatment. And again, on the telephone, they will tell you what to do.